Ignaz Semmelweis is known as the savior of mothers for his contribution to public health that prevented thousands of mothers' deaths in childbirth. Here is his incredible story. On July 1st, 1818, Ignaz Semmelweis was born in Budapest, Hungary, to a prosperous family. In 1837, at the age of 19, he became a law student at the University of Vienna, one of the largest in Europe. After a year of studying law, he switched to studying medicine. He earned his doctorate from the University of Vienna in 1844 and went on to specialize in obstetrics. His time was considered a golden age for doctors because they were being trained as scientists as well as focusing more on anatomy than ever before. In 1846, he began work in the obstetrical clinic at the General Hospital in Vienna. This institution had two different maternity clinics, one staffed with male doctors and the other completely with midwives. Here he tracked the differences in the number of deaths from the two clinics and found the doctor's death rate to be 5 times higher due to a more deadly cases of puerperal fever, commonly called childbed fever. Semmelweis also observed that women who delivered babies in the streets almost never got this deadly disease. After testing many different factors to find the cause of the staggering difference in death rates, he realized the clinic doctors were performing autopsies between seeing patients and midwives were not. This led him to hypothesize that leftover particles from the cadavers who had died from the fever were getting into the new patients when the doctors examined them. With this conclusion, in 1847, Semmelweis advised doctors to clean their hands and tools with chlorine between patients. He and his students also wrote letters to some prominent maternity clinics describing their recent observations. The doctors at Vienna Obstetrician Clinic followed his advice for several months and deaths dropped by 90%, matching that of the midwife clinic. Although it seemed to be working, Semmelweis' discoveries went against popular belief that disease was caused by bad air, which could be treated through bloodletting. These preconceived ideas left little room for doctors to seriously consider his idea of antisepsis. Many doctors were even offended by his ideas, and the clinic ended up rejecting his life-saving practices. To make matters worse for his case, Semmelweis could offer no real scientific explanation for his discovery except that miraculously it worked. Not everyone was against him, though. Ferdinand von Hebra, a medical journal editor, shared Semmelweis' discovery in several issues of a leading medical journal and claimed that Semmelweis' work was as significant as that of the man who discovered the smallpox inoculation. Nevertheless, Ignaz Semmelweis lost his job for standing by his claims. People even began to call him crazy. In 1851, he took a lowly, unpaid, honorary head physician position at an obstetrics ward in the small St. Rochus Hospital. Here he virtually eliminated childbed fever by using disinfecting methods. In 1857, Semmelweis married Maria Weidenhofer, and they had 5 children. He went on to publish the book called The Etiology, Concept, and Prophylaxis of Childbed Fever in 1861. Just a few years later, at the age of 47, Semmelweis was committed to a mental asylum. His condition was probably brought on by syphilis or Alzheimer's. Here, he ended up dying from a bloodstream infection. The same sort of thing he was trying to fix in his career is what killed him. It was not until years after his death that the germ theory was discovered and widely believed, making his ideas of disinfecting doctors' hands and instruments a logical choice. Today, there are still tons of patients that die in hospitals due to infections, but just think, it is much lower than it could be thanks to a man named Ignaz Semmelweis. Institutes created in his memory include the Semmelweis Clinic, a hospital for women located in Vienna, and the Semmelweis Hospital in Miskolc.